My name is Terry Mamounas. I'm the medical director of the Comprehensive Breast Program at Orlando Health Cancer Institute in Orlando, Florida. So how will the breast look after lumpectomy or even after mastectomy is a question that patients often ask. And we also cover this question usually when we meet with patients to discuss surgical treatment to give them an idea what they should expect. So let's talk first about after a lumpectomy. So how the breast will look and feel after a lumpectomy will primarily depend on several factors, but primarily would be a function of the tumor size, the breast size, and also the location of the tumor in the breast. In general, obviously, the smaller the tumor and the larger the breast, and also favorable locations, as we'll call them. In other words, when the tumor is in the upper part of the breast versus the lower part of the breast, where the contour of the breast is preserved, even if you remove some tissue from the upper part, the breast will feel and look much more natural and normal in this situation. So if you have to remove less tissue by having a small tumor and having a large breast, where the defect is minimal, and we have ways of minimizing this defect, the breast could feel actually very much the same after a lumpectomy for these patients, have minimal distortion and excellent cosmetic result. But if the tumor is sizable, it's very centrally located, let's say behind the nipple, or if it's in the lower part of the breast, the lower inner part of the breast, or even lower outer, then there may be some contour deformity when you remove the tumor from the breast. And even if you can fill it in with some tissue from surrounding areas, there still may be a little bit of pulling and indentation. So we warn the patients that that may affect in somewhat their cosmetic result. In such cases, sometimes if the tumor is sizable, we involve our plastic surgeons and do what we call an oncoplastic reduction, where you can actually have the plastic surgeon sort of reshape the breast and give the patient a very nice contour, even if you have to remove tumor from this sort of less optimal areas, if you like. Now, in terms of how the breast will feel, typically following lumpectomy, breast conservation, we give breast radiotherapy. So obviously, initially after breast radiotherapy, the breast may feel a little swollen and a little darker skin, a little sunburn effect over radiotherapy. Those effects eventually dissipate in a few weeks and months after the end of radiotherapy. And technically, the breast should feel almost like the other breast in terms of texture. Occasionally, although the breast may develop a little bit of lymphedema on the breast because we do axillary surgery as well, particularly if there's an axillary dissection followed by local regional radiotherapy. The breast may feel a little bit heavier and thicker. The skin may be thickened as well. And sometimes may look like what we call the peau d'orange or orange peel look. And that's incidentally and also a sign of inflammatory carcinoma. But in these cases, postoperatively is not a sign of inflammatory carcinoma. It's sometimes a sign of lymphatic stasis, that the lymphatics are not draining the breast very well. So you have to also warn the patients about that, that is something that potentially can happen. Although in general, with a sentinel lymph node biopsy, we don't have much lymphatic stasis, and the breast looks and feels pretty normal, particularly, again, if we operate in the upper part of the breast for small tumors, and the breast has enough tissue to cover the lumpectomy defect. As far as how the breast will look after mastectomy, obviously that pertains to the question of reconstruction, because if you have a mastectomy but you don't get reconstruction, then you'll have essentially a flat chest wall. That's what we're trying to do. We're trying to remove the excess skin surrounding the breast so we can give the patient a very usually horizontal scar in a flat chest, almost like a man's chest. But if there is reconstruction involved, then the patient will usually get a temporary expander placed at the time of mastectomy that gives the patient some volume, so they may not be totally flat after this procedure, whether it's a unilateral mastectomy, obviously, or bilateral mastectomy. And that expander eventually will get inflated to provide some volume into the breast with saline until then the next stage of reconstruction takes place, which could be exchange of the expander for an implant, or sometimes an autologous tissue flap, like let's say a DIP flap. So that's what they should expect. In terms of how the breast feels after mastectomy, generally there is a lack of sensation because the connection of the sensory nerves gets cut in the flap. So there will be some numbness in the mastectomy flap that actually sometimes helps with the postoperative pain, of course, but that's something that may persist for a long time and eventually maybe even for life sometimes. But often, not unusually, we see that some sensation returns months and years later when the nerves essentially regenerate. So there will be some form of numbness after mastectomy, but in general, the breast, if there is some reconstruction, there will be a mount, and depending, of course, if the mastectomy is nipple sparing or skin sparing, you may still have the nipple present, and obviously that's a much better cosmetic result. In a skin sparing mastectomy, the nipple is removed, and then it gets reconstructed later on. So these are some of the my thoughts about as we discuss with patients how their breasts will look and feel after these procedures.